the Huilongguan Hospital, as well as the Madam Chen Xuefeng from Psychological Institute of Chinese Academy of Social Sciences. They will answer the question based on the theme, Social Psychological Service in Epidemic Control. First of all, let me give you the new update. By the 24 Beijing time, February 2nd, reports from the provinces and the autonomous region from China reported new cases, confirmed cases 2,829, and 2,103 from Hubei province. New severe cases 186, with 139 from Hubei province. New death cases 57. And 56 from Hubei province, and 1 from Chongqing municipality. For new cured disease, 147, 80 from Hubei province. New suspected cases, 5,173, among which 3,260 from Hubei province. Also, by Beijing time 24 February 2nd, NHC received reports about the accumulated cases. Let me give you the new updates. For confirmed case, 17,205, with 2,296 severe cases. Accumulative death case, 361. Accumulative cured cases, 475. And totally we have 21,558 suspected cases, with the close contact traced, totaled 189,583. Of medical observation reaches 10,055. Totally, we have 152,700 patients and the people under medical observation. Reports from Hong Kong, Macau, and Taiwan totaled 33. 15 from Hong Kong SAR, 8 from Macau SAR, and 10 from Taiwan. So much about the update of this press conference. Now let's come to the Q&A session. Before you raise your question, please tell us where you're from. Okay, now the floor is open, please. Yeah. This lady, please. Thank you, Chair. I'm from CNR and from CCTV. I have 2 questions. And currently, we understand different group of people, they may have different mental problems. Do you have different types of interference measures? And also, with more needs of the mental health, what kind of channel can provide such mental health consultation? And also, during the past times in the report, you mentioned a lot of medicine for the clinical diagnostic, and also there are some new updates. I wonder if NHC can introduce to us about the use of the medicine during the process. Thank you. So, Madam Wang Bin, please answer the first question. Okay, this is the critical period for the prevention and control of the epidemics. With the passage of time, general public need consultation and in order to reduce their confusion and uneasiness, we have compiled a contingency psychological intervention and consultation guidelines for this novel coronavirus pneumonia prevention. We have the patient suspected cases, confirmed cases, as well as the frontline medical workers. They are different types of groups. They may have some different psychological problems. So we focus our convention based on different groups and also the experts' research into their situations. We have the self-assistant and the counseling guidelines. These guidelines will just give guidance to different group of people on the self-rescue of their psychological problem, and at the same time we provide the service or social service-based psychological intervention. You may get this brochure, my dear friends, from media, and you may just read it afterwards. And also, we require different provinces based on their existing hotline for psychological consultation, and we ask them to try to find more resources services. And for example, in the past, we have the hotlines for education and for the social workers, and as well as the psychological assistant hotlines. So we try to find different sources for the psychological assistance, and we give them the trainings, and we organize them together to provide the psychological consultation service. We also hope that in our universities, in many universities, they have the student consultation center, which may provide the psychological consultation for students. So we really encourage those psychological consultation centers from different universities and colleges also provide the counseling and intervention for those patients, suspected patients, and other group of patients and persons. As I mentioned, we do have the self-assistant-based intervention, and you can also have access to all the measures from our health app or other website. You may just have access to those websites and search for the information you need. And we also work with other associations. In the website, they release the information as to how to release pressure, how to help those people who are suffering from fear to get rid of those symptoms. So you may receive constant help. No matter from the social perspective or from the individual perspective, we need to be reasonable, and also we need to make decisions based on our reasonable judgment of the situation. We need to build our health immune system. Here, health including the physical and psychological health. Of course, we already have some prevention measures. It must be effective, and also we need to believe in ourselves. People or person may have their immune system there. It's like a battlefield. We need to be optimistic to win the battle. We need to be confident to win this battle. Thank you, Madam Wang Bin. Next, I'd like to answer your second question. Yes. Currently, the rescue of the patients is important for this epidemic development, and people attaches great importance to the evolution of this. So first, we have the Chinese medicine-based rescue, as well as the one Western medicine, Keliji, and the other one is called Rada Heavy, and many the medical service provision center or the institutions has implemented the trial studies for the effectiveness of this medicine. And also NHC and the Bureau of Chinese Herb Medicine work together to summarize the successful experiences. We have already drafted the diagnostic and treatment protocol for the NROV disease, and we list the Chinese medicine and the Western medicine. The description is quite concrete, so you may have access to our website, NHC website, for more detailed information as for the specific medicine taken and recommended. Okay, so much about my answer for this question. Now let's continue with the questioning. Okay. This one, please. I'm from Chinese Educational TV. I would like to ask, we have a lot of suspected cases and confirmed cases. They both are increased substantially. For those suspected cases, they worry, what if they become the confirmed cases? For the confirmed cases, they worried about the severeness of their case. All these are psychological or mental problems. It will influence the rescue and the cure of their disease. So how do we relieve their pressure or stress? Okay, Mr. Wang, please. Okay, with this question, there are several points I'd like to mention, because when we are confronted with infectious disease, we are pressured, we are stressed, and we may have some negative impacts of our psychology, and so we need to try to adapt to the evolution of these epidemics. There are different layers. Layer 1, we have to understand when we are confronted with infectious disease, we may have this, what we call the stress reaction. And for the stress reaction, there are 4 phases. The first one is we are very cautious. We are worried, what if I become the suspected cases? So we are so cautious about the situation. We feel feared, we feel uneasy, and that is the first phase. And it will pass very easily. Then we come to the second phase. We call that passively defense period, meaning we cannot do anything about this. We want to do things, but we cannot. So we have to be there passively. We try to avoid it. We try to refuse the fact, to admit the fact that we can become a patient. So that is the refusal stage. And then we come to the stage number 3. That is, we adapt to the situation, meaning after the evolution of the epidemics in a very short period of time, we start to realize, okay, something happened, it's true. And then we start to adjust our thinking. We face the situation, we take active measures to deal with the epidemics. The fourth phase is what we call the recovering and growing period, meaning during this period of time, we have already stepped out of the confusion and the stress reaction period. We become mature to face this challenge, and we are more experienced. We may have active self-monitoring, and we may take measures to address this. So all these are what we call the stress reaction. In phase 1, phase 2, we hope we can pass the first phase, and then we come to the third and the fourth. We realize or accept the real situation, and we try to recover from it. And also, there are 5 points for us to address this. Number 1, we need to manage our emotion properly. In a simple word, it means that, this is this is not a normal case. So you may have fear, and people may suffer from such uneasiness. So that is all normal from the psychological perspective. That is the normal reaction towards a abnormal event happened. So that's the first point. The second one is that we need to perceive our own stabilization. So here I talk about stabilization. First, you need to have a good sleep, good food, and also you need to have a fixed place to live. Meaning, if you can sleep well, eat well, you have a good apartment to stay, you may feel the sense of stability. Second one is to adjust your thinking or way of thinking. So how do we adjust that? You can breathe deeply. You need to relax intentionally. You need to do some, for example, the meditations. So these are some measures that can calm you down. The third one is that we need to take some active response. For example, you can do some exercise, do some sports. You can find some good friends, close friends, to talk, to chat. Even you can discuss with your great friends about some of the topics which may influence you or impact you. And also, you may use some spare time to enjoy something you cannot do because of the busy life.
For instance, watch TV, listen to music, or to read a novel that you don't have time to do in normal time. Thirdly, through this kind of self-adaptive adjustment, and by talking to your friends, if you still cannot, make a difference, then you can call our psychological service hotline, as Madame Wang said. This psychological service is available with this hotline because it's private, it's very convenient, and it's a very good channel to get professional assistance. So I'm sure with all this means available, it will help us to adjust to this kind of stress reactions and do a lot of help.
A live press conference there where Chinese health officials
to adjust to this kind of stress reactions and do a lot of help to us. Thank you. Let's continue with the questions. Second row. Thank you. From Economic Daily. My question is, with the delay of the spring semester or the prolonging of the holidays, a lot of people will stay at home further, and to avoid outdoor activities. For some of them, they would feel kind of panic or kind of distressed. So how to deal with this kind of situation? Thank you for your question. We do need people to stay at home, refrain from going out and refrain from gatherings, so as to be responsible to yourself, to people, and to minimize our outing. Of course, if you stay too long at home, you feel kind of anxious, anxiety, look at your phone too much, too frequently, and you feel kind of distressed. The major reason for this kind of negative feeling is because of the inconvenience, because of the change, due to the change of lifestyle. Because of the outbreak, our working lifestyle, has changed. We had no choice. That's because we need to do this kind of things to prevent the further deterioration of the outbreak. So we have to be aware of that, how to adjust our lifestyle so as to rebuild our balance. That's essential for us. So how to make adjustment to our life? I've got 5 recommendations, or 5 E. First one, we should put in place a plan and to make arrangement reasonably, what you should do in a day, especially, this diet, sleep on regular basis, and then, reading, listen to music, or try to learn something new. Try to distract yourself and to enjoy that process in doing this kind of things. Thirdly, is to identify support from your family, from your friends. That's essential for us. You can do your homework, household chores, or do these kind of things so that you could be distracted from this outbreak, and don't complain. If you don't do that with your families, you can call your friends, or chat with your friends, so as to take the best use of your resources. Fourthly, sports. Do sports. When you feel distressed or anxious, you can do some, Tai Chi or your favorite sports. There are many good sports app that you can together do the sports with your friends electronically. And also reflections, try to reflect, do some reflections, what you can get from, in terms of values from this kind of experiences. As Mr. Yang said, if you still feel painful and panic, then as a last resort, you can, try to get some psychological counseling by calling the hotline and try to get this kind of professional psychological service counseling. Try to be in a better mental status is going to help us better address this kind of challenge. So, have a good positive emotions to try to improve your immune system. Thank you. From Shenzhen cable TV, we used to watch a video, a doctor in protective gear. He broke down when making call, and he came down after being receiving counselings. So I think the same kind of things happen to these policemen, these medical workers. What are the psychological status of these workers? I would like to get your suggestions as to how to better caress and alleviate this kind of bad mental situation of these workers. Thank you for your good question. It is true, the first line medical workers, those people who are doing the screening in the community and traffic police, they are under a lot of pressures. Psychologically, physically, they are kind of reaching certain limits, their limits. So it's fair to say, to offer some help to them. More specifically, for instance, because we cannot work, too hard for too long. So for this group of people, we try to, kind of limit the workload so they can work in shifts. They can rotate in shifts. And also while they rest, we should play music so that they could maximize and get relaxed during their break. Secondly, they themselves should have access and master ways to get relaxed and relieved. Unless individuals, know how to do that, it's likely that you're going to be in trouble. For instance, when you feel distressed, you can cry for a few minutes in a very private place. And after that, you feel very much relaxed after this cry. Just like, in overcast sky, only with the torrential rain, then the sky will become very clear. And also, where condition permits, in our office, or you can place, boxing sack, a bag, kind of boxing bag, where you can practice some boxing for a few minutes, and after which you get very much relaxed. And also you can do some, chat with people you would like to chat, talk. That's a very good way of, try to get distracted and get you relaxed. Thirdly, this crucial and difficult time, we should do some sports, some indoor sports, practicing Tai Chi or weightlifting, kind of, because sports help us to be psychologically in better shape, and it's a very good way of alleviating our psychological pressure so that our bodies, minds would get relaxed. Fourthly, for a lot of people, they have been working very hard and they haven't any chance to see their families. So try your best to talk to your family, your beloved ones, because your essential support would be from your family members, your beloved ones. So I know you're busy, but you try best to get support from your family. We are busy, we don't have time to go home, but still we belong to the same family, we are always together. So by doing this, it will help us better get over this very special period. Thank you. This gentleman. CCTV. Many people under close contact or medical conservation, they are not sure what will be the outcome. And also, when people are on the way back to work, they have to go out, but they are panicking. So how could help these kind of people to get over this distress and so that they could see the hope, ray of hope? Thank you. For the people, those under, this close contact and those under medical observation, their psychological pressure stem from the fact that they are paying too much attention to this kind of information or the risk. Of course, you should pay attention to the outbreak and virus, but don't do that excessively. because it's going to be counterproductive. So 3 ways, to alleviate the psychological pressure. First of all, don't just look at this negative information. Rather, you should focus on this positive, information, the good news, in preventing, in fighting against this virus. And also, you should better master and more psychological knowledge. Knowledge that help you to put in place a very scientific way of life and living, work and live. And also to make sure that this knowledge translates into your actions so that you will be more confident in dealing with this kind of outbreak, virus. And also you should work together, be cooperative, with what is being done by the community and the government. I'm sure these measures will help you better deal with this psychological pressure. Those people who have to go out, for these people, they should protect themselves in terms of health and sanitation. Of course, they are under certain psychological pressure, for which I propose 2 things. First of all, you have to analyze reasonably what are your pressures. Different individuals, they experience different pressures. Some of them more emotional pressures, some of them are kind of cognitive pressures. They're being stimulated by certain information which impact their memories. And also, some other people change their behavior considerably. And also, some people will experience these diarrhea, insomnia, difficult to sleep, sleeping difficulty. All of them are normal kind of stress reaction. You have to be aware of that. So, as I said, you have to be aware what kind of pressures you are. If it's emotional, then you can learn some scientific ways of alleviating your psychological pressures online. This kind of meditation, reflections. If you're kind of watching your phone excessively, or other extreme behaviors, or you tend to quarrel with other people, you should proactively adjust your psychological feelings and behaviors. This gentleman from Hunan News Center. How to deal with this kind of problem psychologically for a general public. People, because they panic, they worry they might be affected. They try to check their temperature, body temperature, or just cannot go to sleep because they watch too much, focus on too much negative news. How to deal with the kind of situation, Mr. Yang? For this situation, there's some basic principles. First of all, observation, vigilant contact. So they are the basic principles. Observation. You have to observe comprehensively yourself. Listen to mainstream data, information.
Keep contact with your family members and with your friends. To be more specific, first of all, we need to monitor your body temperature. But you need to take certain frequency, for example, find a time to test your body temperature rather than test your body temperature from time to time. And because if you do it from time to time, it's not really the reflection of your body temperature change. Rather, it's your fear or anxiety towards this epidemics. So that is the way to check your body temperature in a fixed time rather than from time to time. Second, when you need to know more knowledge about the prevention and control of the epidemics, for example, you may spend 30 minutes or 60 minutes, an hour, to check more the information or knowledge about the control and prevention of the epidemics, rather than read news from time to time and keep your mobile phone always with you and read the WeChat information from time to time. It will increase your pressure. The third one is that don't pay too much attention on information and body temperature check to make your routine life very boring and is controlled by these abnormal behaviors. Try to stick to your normal life. The third one is that you need to master knowledge and information, and you also need to have a what I call normal life, proper sleep, proper food. You need to rest for 6 to 9 hours. That is the best hour for you to rest. To sleep too much or too less will do your some harm to your health. And also in your daily life, you try to find something that can relax you, or to switch your attention to something different, something beyond this epidemic situation. That is the best way. Number 5, you need to have some training for relaxation. As I mentioned, deep breathe is a very good way for you to feel relaxed, and it's convenient and it's easy to learn. And also, it's really not easy for us to have this long period of time that you stay at home doing nothing that important. So why not using this time to rest, to change the way of thinking, the way of doing things, to try to watch a good sitcom or a opera or film, or read a book and doing see the doctor. You have to go to those hospitals with the clinic fever outpatient clinic, and then to have more medical care. Okay, the third row gentleman. I'm from China Health Magazine, and now we have a delay of the school days. And also, what if the children or students, they have some chaotic daily arrangement, and others, they may be involved into drinking alcohol or play the internet game. So what do we deal with this kind of situation? Okay, it's actually 2 questions. So first, let's talk about the question about students. You know, after the delay of the commencement of the semester, parents have more time with their children. For different age group, we have different countermeasures. For the preschools, parents' company is very important. Parents and their kids may stay together to try to have some game with a lot of interactions. And if children have some questions about this epidemics, parents need to use this opportunity to educate their children about a healthy life, about the disease, try to comfort psychologically and physically their children. As for those students and parents, I have some concrete suggestions. Number 1, both parents and the students need to respect each other, understand each other, and discuss a plan that they can arrange their life properly. Of course, if the students stay at home, they need to have a plan, or they may have a chaotic schedule for their daily life. And secondly, in terms of their routine, they should have the combination of doing household-related chores, and also they need to have a proper plan, even for parents, because they don't need to go to work. It's a great opportunity for them to understand, to know their children well. So they need a plan to plan it properly about their stay-at-home time. And the third one is the study plan for the students. You know, for many schools, they have the classroom in air. They have online-based educational program. So no matter you stay at home or stay in the school, it's the same. You need to be self-disciplined to watch the online courses in a timely manner. The fourth one is about the emotion of the parents, both fathers and mothers. And parents, you know, you need to know your parents. You are not supposed to be anxious, and you need to have a stable the situation of the control. And if you have bad emotion or bad temper, it will just influence negatively your children's emotion. As for those kids in their puberty or adulthood, you need to respect their independence. As an individual person, you need to discuss with them. You are not supposed to force them to do something during this special period of time. Secondly, we are also talking about the stress reaction measures among adults. Even we are adults, we sometimes feel anxiety, we feel stressed. We do have some way to release it. For example, if we cannot go out, what about some indoor sports? You can sing a song, or you can do some other things to try to relax yourself or try to comfort yourself to release such pressure. Drinking a lot of alcohol or playing computer game for a long time is not a good way. Or sometimes it may bring you more pressure and bad temper. All in all, I think the best way to address these epidemics is to enrich your life by yourself, to do something with real, genuine interest, do things, and read more, and then you can feel the sense of significance of your life, and then you forget about worrying about these epidemics. Okay, thank you. Okay, let's continue. The third row, that gentleman, please. I'm from China Daily. For some of the patients, they have some mental disorder problems. They need to go to the hospital for the revisit, but it's a special period of time. They will feel so anxious about going to visit their doctors for the regular check. And what about other patients? They suffer from depression. Maybe because of this epidemics, they feel more depressed. So how do we deal with those patients with psychological or psycho problems? Or mental problems. Okay, so I'd like to give the floor to Mr. Yang for this question. Okay, yeah, for all the individuals is a challenge, but it's not a problem. First, we need to know for all the chronological disease, they need a very long period of times for the drug taken, and for the dose of those drugs, they are fixed. So I would like to remind those patients with chronological disease, please take drug frequently. Do not reduce the dose of the drug, or you may have the more severe disease of that chronological disease. Secondly, talking about the revisit of the doctors, safety is the fundamental important factors, because there are two things to secure you. The first one, if you go to see a doctor, you need to wear a face mask. That's very, very important. Secondly, you need to wash your hand properly. You don't touch things. If you have to touch things in the hospital, you don't rub your eyes or your nose or touch your mouth, and you try to reduce the contact of your hands with the other organs. And also, secondly, for all the medical institutions, they are managed based on the prevention of the new virus. And if you go to see doctor in Beijing, and before you get into the clinic of the doctors, you need to have 2 body temperature monitoring. Only when you have 2 normal body temperatures can you get into the clinic to see the doctor, which means that we need to screen those suspected patients to give them timely monitoring and diagnostics, and also to guarantee other patients may not be influenced negatively because of this suspected case. So with these measures, it's safe for you to go to the hospital if you have to. And also for the hospitals, they are strengthening the management. For example, for those outpatients, we have the single direction traveling through the hospitals. Temperature check first and register second, and see the doctor and take the medicine. So it's a one way rather than both way. And then we can avoid cross-infection during this process. Of course, different hospital may have different measures. If that hospital have some fever clinic, the fever clinic is separated from other clinics. So all these measures are used to safeguard the common patients, to ensure they have safe hospital visits. neurological disease patients, if they suffer from anxiety and because of the stress reaction, they may have the severity or increase the severity of their disease. That is something we are also concerned. So, for example, other psychological problem patients, like they suffer from depression or anxiety. Number one, they need to have the self-comfort first. Second, they need to adjust the dose of their drug. Then they can control their emotion properly. Thirdly, and most importantly, they need to seek help from their doctors. Of course, we could have the online diagnosis. We could use those apps from different hospitals for the contact, but still they need to deal with themselves according to the change of their symptoms. They need to manage their disease properly too. Thank you. I'm from Yangtze River Daily and from Beijing Station. I have two questions. First one, in Wuhan, they have blocked down the city for dozens of days. In Huanggang, they also have some other lockdown measures. And do you have any suggestions for the people living in Wuhan and Huanggang? The second question is that online or in real contact, for those people which are from the epidemic zones, people may have some strong emotions towards them. How could we comfort people from other areas and their attitudes towards the people who are from Wuhan and Huanggang? Okay, answer your first question. In Wuhan and the surrounding cities, we have very severe traffic management system. That is for the prevention of the epidemics is necessary. Now, we all understand that that is a very necessary step for us to control the epidemics. And therefore, we have the following recommendation. For the people who live in those epidemic areas, we need to understand that this is a necessary step and we need to adjust it to this new situation. And also, we have answered many questions raised by our journalists. How could you attack your emotion, your lifestyle towards this new situation? You may try it. So that's the answer for the first question. The second question, in terms of the people's attitudes towards the people who are from the epidemic zone areas, to have this kind of reaction is the natural reaction for the people who are from the epidemic area. But people do not live simply based on our natural reaction. We are reasonable sometimes, right? So sometimes we find reason for a problem. For the epidemics, the reason is that we find a new virus. At first, when we know nothing about this virus. With the passage of time, with more research, now we have better understanding towards this coronavirus. And in our prevention routine, we have more and more measures for self-protection, and we are armed with the new knowledge to attack this coronavirus. Therefore, we need to be more reasonable. And we also need to see the efforts of the people from our society. And we need to build our confidence to combating this new virus. You know, epidemics is our common enemy. People who are from the epidemic zones, they are our friends, they are our relatives. We do not simply feel hostile to them because they are from the epidemic zones, or we may have more barriers or burden to win this battle. So we need to unite and to understand each other, to support each other, to battle against our common enemy, that is the virus.
So, in the interest of time, so that's the end of the Q&A. So the theme of today's press conference is about these how to address psychological problems resulting from this outbreak. Tomorrow, we'll continue with press conference. We're going to focus on the treatment of these severe cases in Wuhan. So please send your questions to us in advance. Thank you very much for your support. Thank you. Thanks for coming.